There has been a lot of talk about vaccine hesitancy ever since the vaccines came out, but there is a difference between being concerned and refusing to get the shots. Our Nixon Norman tells us more about that difference and what people can do to feel less concerned.
Hesitancy does not equal refusal, and I've actually been saying that over the last number of days, but hesitancy to me as a physician means that persons need more information.
Landers goes on to say it's not bad to question, but it's a good idea to get answers from those who can speak to the facts.
The first thing I do is to urge people to ask your questions. But ask your questions of persons who have training and experience. I mean, I receive my medical information from medical providers, from scientists.
She also says it's okay to change your mind when it comes to taking the vaccine.
Ask your questions, do your research with vetted sources, and be prepared to change your mind.
And talks about how she has seen people change their mind firsthand.
Persons who initially were reluctant when the federal pharmacy program came in and vaccinated patients and staff members, and there were persons that were reluctant. By the time they came back to give the second dose, some people had changed their minds, so they had to schedule additional time. So we had additional uptake once persons, first of all, received more information, had opportunity to look at scientific information, but also had the opportunity to see other people take the vaccine, tolerate the vaccine, and do well.
And hopes that this trend continues.
We've actually seen a reduction overall in vaccine hesitancy, and that's what I hope will happen.
Putting the Valley first, Nixon Norman, WZDX News.